Hello, everyone, and welcome to episode 53 of Daffy's Roundtable. My guest today is someone you may already be familiar with if you listen to Reptile podcasts. She has done two incredible episodes with Dylan at Animals at Home podcast and an incredible episodes with Project Herpetoculture. Dr. Kelsey Chapman, everybody. In this episode, we discuss reptile surgery and research and how hard it is to find information. We also discuss parasites in your collection, common reptile problems and controversies, and how important gut loading and vitamin supplementation is. Before we get into this episode, let me thank Exoterra for sponsoring this podcast and for making this episode possible. Exoterra makes quality products for our pet reptiles to make them feel at home. Also, when you're done listening to this, go check out the episodes with the Animals at Home Network. They are truly incredible episodes with incredible information in them. Go check them out. Okay, without further ado, everyone please help me welcome Dr. Kelsey Chapman. Dr. Chapman, hello.
Hi, how are you?
Doing good. Thank you very much for coming on. I'm super excited. How are you?
I'm doing well. It's a pleasure to be here. Thanks.
Awesome. So let's dive right in. Can you tell us how you got into where you're at and how you sort of developed the love for reptiles and what made you decide reptiles in the end? Or I guess all exotics, but mainly reptiles.
It's always the main question, and it's a good one. Everyone's journey is so interesting, how they get to where they are in their lives and what brings us right to this moment talking about the same things. I grew up as an only child, and animals were my friends and were my family in some ways. I swam, so I had lots of siblings in that world, but I always knew that I wanted to do something with animals. So I grew up riding horses. I had all different types of pets. I had mice and newts and would always catch fish from the lake that I was near. And then when I went into school, I took a bit of a different route because I heard that vet med was hard to get into. So I got a bit scared and I didn't apply early on. I thought I would maybe write. I wanted to be a writer. I wanted to do psychology, which was, I don't want to say an easy out in school, but it was just always very interesting. So I thought I could do that. And then one day someone said, well, you have a science degree from the University of British Columbia. Why don't you do vet med? And I said, oh, it's just too hard to get into. And they said, you should try. So I tried and I got in. I was on the wait list for a few hours, which was terrifying, but I did get in. And it was a really good decision to go into that. Though it's a difficult profession, it's super fulfilling. For exotics, I always knew I would do exotics at some point just because that's what I'd always been interested in. But I assumed that I would do it alongside doing other animals. So doing horses and cattle. I wanted to live in the country, not in the city. But I went to a clinic, Calgary, Avian and Exotic, where I am now. And I realized that you could do this. What I was looking for was the variety of species and the challenge of not knowing everything about all of the animals. So that was what I ended up choosing. I was doing that. I think I missed a small part in there. When I was a little child, I wanted to be a dinosaur vet.
Okay. Yeah, that's a very important part, of course.
Yes. So I got pretty close.
Yes. Do you ever see dinosaurs?
Chickens are the closest, and so I like chickens. But I always look at, especially the really cute reptiles, which is, in my opinion, all of them. They do look like little dinosaurs, tortoises especially. But yeah, it almost a weird way of going back in time. I think you look at them, even if they're young, and you think you're ancient in some way.
Yeah, absolutely, 100% agreed. So you mentioned there. Well, first of all, I want to say I'm sure you just made a lot of people very happy with that story because I know a lot of people are trying to get into that step and don't want to take that step into vet med and maybe that was your sign. People go do it. But so you mentioned you're doing chickens, so it's not just reptiles that you're seeing. What other kind of animals do you?
So our clinic sees anything you can keep in your house that isn't a dog or a cat. Okay. We see, it depends on what the laws are in your area. So I see everything that's legal in Alberta. So rats are one thing that I don't see currently that I miss out on because I really quite like rats. But we would see on a daily basis, perhaps, I probably see more reptiles than the other vets just because I preferentially scoot them into my appointment book. But maybe 30% rabbits, 30% birds, all different types of parrots from little budgies up to giant macaws, chickens, crows, and then random things that change with time. So there has been some changes in how you can give out antibiotics in the fish world. So we've had a lot more fish clients recently. So we've had to just kind of catch up on our fish knowledge. I have a few large fish clients as well, like importing companies. I've worked with aquaponics people as well, big productions with that kind of fish production. And then the guinea pigs, which are, I think, very cute, and chinchillas, sugar gliders, marmosets sometimes. So it's a real mixed bag. So no dull days for sure.
That is very, very cool. Okay. There's a bunch of questions that are ready for you, but now we're going to take a quick side because I need to know a little bit more about this fish. So like, are there clients that bring their fish to the vet on regular basis?
Yes. Well, a regular basis, I would say for now, perhaps not. Most animals we can see yearly. Most people are pretty amenable to bringing their pets in for a yearly exam, which I think is really important because when you see the animal every day, you don't notice the little changes because they're so minute. But when I see it once a year, and I have my notes that are pretty detailed, I can go back and say this is different. So fish, I wouldn't tell you that many fish come in for their healthy annual health checks.
Yeah.
They come in when they're sick. So the hard thing for both sides of this, for the client and for us, is that there are regulations. So for me to be able to prescribe antibiotics or prescribe any medication or even practice veterinary medicine, which is including the process of diagnosis, I have to have what's called a valid patient-client relationship under the Alberta Veterinary Medical Association. So they deem that as, I know the client well, or I've been to their house to see their collection, or within the past year to maybe 16 months, I could probably get away with, or 18 months, sorry. I have to know the general health of like their flock or what that animal is. So I follow those rules by, if someone has a tank disease, I'm okay with them bringing me a water sample and one of the animals, because then I can at least, if my governing body ever comes after me and says, why did you prescribe this medication? You don't know this animal. I can say, to my knowledge, I know as best as I can. I've gathered so much information from how they keep their pets, what their tank is like, and I can justify that. So yeah, yearly health checks on fish, I wouldn't say are there yet. And, I don't know if that's a bad or a good thing. It's stressful to bring a fish in.
For sure.
If I can do a good enough job without having them come in all the time, then I think that's the best thing I can do for that species anyways.
For sure. That was actually my next question. Like, is it always sort of medicating the water or medicating the tank, or are there ever actual situations where you have to, I don't know, inject the fish? Because like it's in water. Like how do you deal with that?
That's a good question. So I always find this to be an interesting topic. Yeah. So freshwater fish, the main thing that they're trying to do with their bodies is keep their salts. Sorry, that's my cat.
That's okay. Yeah.
I'm going to say hi.
It's part of the experience. Yeah, there we go.
This is Gooey.
Hey. Gooey is adorable.
Gooey. Okay, bye. So freshwater fish, their main job is to keep water out of their body, because on the inside of a body you have a balance of solutes and solvents, so like the water and the particles in it, so the electrolytes, all that kind of stuff. So when you're in freshwater and you're freshwater fish, your main job is keeping water out. So if you were to put antibiotics into the water for a freshwater fish, they're going to get very little because they don't really intake that much water. Their whole job is keeping everything out. So medicating the feed is the best way to treat that fish, or injecting that fish, and you can definitely do both. So I usually prescribe, if a fish is truly sick, I suspect or I've diagnosed a bacterial infection, I will usually prescribe an injectable antibiotic. It's a similar one that I actually use in reptiles. Most antibiotics we use cross species, but there are some good medications for fish that you would give in the feed. So for large scale productions, treating the feed is going to be the best way to do that for freshwater fish. For saltwater fish, it's a little bit different. You could maybe put it in the water, but honestly, getting it into the animal is going to be the best thing, and less waste of medication. Because anytime you put antibiotics into the water, you do have to think about where that goes, where you dispose of it. So if you're going to put that into the sink, now you're creating antibiotic resistance downstream. So.
Oh, that's actually a super interesting point. I don't think, and that's probably why it's a lot harder to get fish medicine now, correct? Because people doing things like that?
Well, I would suppose, yes, but it's multifactorial. I don't actually know all of the reasons behind why the decision was made. I guess perhaps they didn't make it completely public, but I think that's part of it, is that we don't want to just be throwing antibiotics out willy-nilly. You don't want to be just treating things with antibiotics if you don't know why. And a lot of fish people have a hard time with that. And I understand that, because a lot of really big fish keepers, there may be a better word for that. I don't know what it is. People who keep fish.
Fish keepers. No, absolutely. Yeah.
They know fish, and they know their fish probably better than I do in some scenarios. So they feel like they should be able to treat their fish with antibiotics because they know how it works. So it was, I think, very hard for them to all of a sudden not be able to get it over the counter. I think our job as a vet now is to be able to work with people that know so much about their animals and be able to say, this is my knowledge gap in your species. I need to know what's normal. I need to know how to help you, because I'm now the gatekeeper of the medication. I think that's a process, total tangent, but I do think that's an issue that some vets get into, and medical professionals as well, is that we don't give credit to what someone might know, and we don't work together in filling those gaps.
Right. But do you also find that it goes the other way around, and sometimes a lot of keepers are thinking they know more than they actually do, and then
For
they're
sure.
yeah.
I think so, but I think there's a gentle way of discussing that and saying, that's an interesting point. I think I know where you get that from, where that idea comes from. Let me tell you what I know, and let me see if that changes your mind.
Yeah, for sure. Okay, awesome. So jumping back to reptiles, do you think that with the hobby becoming more and more popular, that like same question as fish, like people are actually just bringing the reptiles in for checkups now, and it's not only when they're sick, or is it still majorly like only when something's going wrong that they bring them in?
No, I see quite a few reptiles for their annual health checks. I would say on a daily basis, I probably see at least one annual health check reptile. The most common species would be tortoises.
Tortoises? Wow. Okay.
Tortoises and turtles, and snakes as well. You know what? Bearded dragons come in all the time, actually. People are getting really good about bringing those animals in and understanding that there are changes that can happen quite quickly.
Yeah.
And if I see them one time for their first annual health check, that's my job then to explain why it's important to come in once a year. I think there's a hard position that that vets have been in the past, especially through dog and cat medicine, where they've been labeled as money grabbers because they tell people to come in and get their annual vaccines every year.
Yeah.
Where we have failed as vets is in communicating to people the importance of a yearly physical exam, and in communicating to them our honest answer of, we don't know how long these vaccines last. They could last 2 years. They could last less than a year. It just depends on your animal's risk factors for how they're going to come into contact with that virus or whatever they're vaccinating for, and how long this might last in their immune system. So I think that annual health checks are super important, and I explain to people why they might be important when they come in for their first checks. But reptile people, everything's getting more common, right? Having reptiles as pets is getting super common. Understanding that there are vets out there that see reptiles, which is a thing for us too. The more vets that are willing to see reptiles and willing to put in the work to get a little extra knowledge on how to treat them, or at least say, hey, I know a reptile vet that works at Calgary Avian. Why don't we have a consult with her and we can all learn together? Reptile people are now, since we're more accessible as vets, I think that it's just becoming more natural for them to take their pets to us.
Yeah, absolutely. So one of the thing about reptile keepers is that a lot of the times it's you go from having one reptile to having many reptiles. Is there a recommendation that you guys like that you have for people with a big collection? Like, do you expect them to bring every single reptile to the vet, or do you think there's a way to kind of get a general room check? Or yeah, what do you think about that?
That's a good question. I think that with some of the silver linings of COVID that had happened is that the idea of telemedicine has become more accepted, both in the veterinary community and with people. So it's going to depend on the vet that you contact. I would love to have a system where telemedicine is accepted, and I could see your reptiles through the screen and go through different questions that you might have and just charge on a time basis. I think that's totally acceptable. It's just whether or not the regulations within the veterinary community catch up at the same rate. So say I were to do that and then prescribe you antibiotics, and say you were to misuse them in some way, my body might come back at me and say, well, you didn't have a very good relationship. You didn't actually see that animal. So how can you diagnose it? So I do hope that we can all kind of catch up in the same way and understand the feasibility of bringing in every reptile. It's not going to happen.
Mm-hmm.
What I have for some clients, what I have is a relationship where I've been to either their collection or I've been to their store. And then if they have a sick animal that I need to see, I can say, yeah, you need to bring that one in because there's just things that I can't do over the phone. There's things I need to touch, use all my senses to do the exam, and then tests I may have to take. So large collections, I think it just depends on what your need is. If you're really interested in a vet's point of view and you have one that you might trust, I would contact them and say, hey, I'm looking to get some vet advice. What's your comfort level with either coming to do a home visit, doing telemedicine, or having me bring just a few animals in to start building that relationship?
Yeah, that's super interesting. I think that's the best way as well, because I've like I'm trying to think of it as well. If bringing every single animal, not only is that going to be super costly, it's also going to be the kind of case where now, like, whatever, you have 20 individual animals, that's 20 different vet visits. That's time consuming as well, right? And if you have to do that every so often, it's something you have to consider with having, which on its own, having a big collection is something you need to consider and and take
Yes.
factor in, but that definitely makes it hard. Okay, what do you think, like, or to bounce off that, how often do you see wild caught animals, and then how often do they have parasites, and then so to bounce off that, how often does it affect the entire collection if not quarantined properly?
That's a good question. I feel like most wild animals do have internal parasites. I think it's very common, whether they're reptiles or not. When they're in captivity, it's a stress on their GI tract that we can take away. I prefer to test them. So we would do what's called a fecal test, and you would look at if there's parasites in there and identify which kinds they are and identify which medication may be needed. There are some internal parasites that, though I wouldn't say they're commensal, so that not necessarily providing anything to the gut, they're very common and very well tolerated. So it would depend on number. So I don't always treat. It's just if, say, there's diarrhea or something's happening where the animal's losing weight, I would usually err on the side of treating if I found something. But if there is a low number and it was just a test that they wanted to do once a year to check, or it's a new purchase, then I may not treat. It'll be up to the vet at that time to decide. How common would, and even so you ask how common were our parasites in wild caught animals? I'd say they're common in captive bred animals as well.
Wow.
They're transmitted fecal oral. So if there's poop around and the animal comes into contact with that, whether it's from other individuals or whether it's from the parent individuals that are nearby, or whether it's from uncleaned enclosures, they can certainly pick that up. And then in terms of do they transmit throughout a collection, they really shouldn't. Most internal parasites anyways are transmitted fecal oral, which means you have to come into contact with fecal matter and ingest it for that to complete the life cycle. But things like mites, so external parasites, those can be transmitted throughout a collection because they move. And so that's more common to have lots of things affected that way. And the concern with mites is that they breach the skin barrier because they often feed that way. And then you can get viral transmission, bacterial transmission through different reptile species because of those parasites.
That's super interesting. Is respiratory infection in snakes contagious?
So it depends on what it's caused by. So respiratory infection in any animals can be caused by bacterial or viral, the most common, and those are contagious. But it depends on what they come into contact with and how close. 2 cages on the other side of the room, probably not. But animals interacting with having saliva, having nose-to-nose contact, being very close, I think is definitely more likely. But yeah, there are not too many truly aerosolized viruses that just float around in a room. It's a little bit more rare, I think. But there's, with anything that I say, for the most part, I think not that science itself changes, but what we know and what we've studied can change. So there may be instances about different transmission of viruses that perhaps we don't know of yet. I think a big way that bacterial and viral infections can transmit between animals that we may not think of as well, or maybe we do, is with tongs.
Tongs,
So if you're
tools, yeah.
I would always try to disinfect or have certain tongs for certain species. I would not go from boids to pythons because of, that's a whole thing. But because boids will naturally carry what's called reptorinovirus, which is IBD. So sometimes they'll have that naturally. And that is quite deadly for pythons. So I usually try and, if anything, I'd do pythons first. Any healthy animal first as well, and then sick ones last.
That's super interesting. Is that that's something you commonly see even in healthy animals?
IBD?
Yeah.
And
I don't know if it'd be considered animal healthy if they have yeah.
So yeah, healthy is a hard word, right?
Yeah.
It's hard to define, but there are many apparently healthy or doing quite well, not going downhill in any way, boas that come in that I've incidentally found IBD on. So the way you would find that, I'd be doing a blood test, just a general checkup, and on there will be, it's called inclusion body disease because when you look at the blood cells and other cells in the body, there'll be these little inclusions. They're just like things that you can see on a microscope. So those structures indicate that virus.
That's interesting. And so you said it could be transmitted through tongs or water bowls or anything like that. But what about having a snake room with a bunch of pythons and boas, but nothing's really interacting? Is that something you still worry about?
I mean, this virus has been discovered in the world of scientific inquiry not that long ago. So we don't know that much about it. We know enough to know that it can be, we think, transmitted between mother and child. We think it can be transmitted with body fluids. I would say for sure, I would think mites would do that as well. A truly aerosolized in a room kind of thing, my gut is, I doubt it, but I don't think that we fully know. So I would say that if you just keep your collection separate, best thing if you can keep boids and pythons in separate rooms, that would be great. But if they're on opposite sides of the rooms, just, it's easier to accidentally grab tongs when they're in the same room is all.
Yeah, 100%. I can tell you from experience. And sometimes you grab those tongs and you put them down and you lose them 5 minutes later and you don't know where they disappear. Yes.
Yeah.
Awesome. Okay. What about another controversial topic that's always being debated in the hobby is impaction. So how often do you see animals with impaction, and is there usually a cause for it other than, I guess, they ate substrate or yeah?
That's a great question. I think impaction isn't terribly different in reptiles than it is in a lot of other species. So if we're talking about just straight fecal impaction, so something like a fecal lith, which is just a dried piece of feces that have been stuck in the GI tract, that can be caused from many things. If your guts don't move properly, then you can't get the feces down out to the other end. If you are dehydrated, then it's more likely that they're going to stick. And then in terms of how your guts move, so many things come into play there. Do your muscles move properly? Do you have proper electrolyte balances? Do you have enough calcium? Because calcium helps with muscle movement. Are you moving enough? I mean, they don't have abdominal muscles nearly as strong as we have. And oftentimes they rely on movement to be able to get things moving that way. And are you eating the right substance? I mean, reptile diets are incredibly complicated, and I don't think we actually know as much as we'd like to at this point. And so is there a high enough fiber content? Is there too much or too little protein? And then of course water content as well. Is the water content of your feed high enough? Impactions, I unfortunately see them more than I'd like to, and sometimes I see them in animals that I think the owner did everything they possibly could and it still happens. So I'm not sure if there's a genetic portion or not. I guess everything may have that. The most common ones I see them in bearded dragons, but that could just be a product of how many beardies I see. The most that I see probably are in euros. I've done 2 surgeries in the last 2 months and then seen 3 cases at least in the last couple months on fecal lith impacted uromastics. Surgery on one of them went surprisingly well. I reckon he was 20 grams. He was quite small. Wow. And I got to the point where you can do medical treatment for only for so long. By medical treatment, I mean oral medications, subcutaneous fluids, IV fluids, if that's possible. A vibrator. So there's a study, I can't remember which year that was, done on tortoises where they strapped a vibrator to the plastron and had taped that on for a while, and that had seemed to help with just moving things around. But for this little guy, nothing had worked, and he was declining quite rapidly. So I did an emergency surgery on him, got it out, and my goodness, it was the size of a third of his body. And I just got a text from the owner a little while ago, and she said he's still doing really well, which I'm very happy with. Surgery doesn't always go that way. There can be inexplicable reasons why it doesn't work. There was another Euro that I had done a surgery on, and she was overall, from what I could tell, quite healthy. Surgery went normally. She seemed to recover okay after, and the next day she had passed away. We sent her body off to do what's called a necropsy, so an autopsy essentially. The surgery site was fine. Everything was fine about her. They couldn't find why she passed away. So we just need more information on reptiles. Clots are probably common. She could have had a clot or something go somewhere into the brain and had her pass away, which just happens after surgery sometimes. But I would say that's the most common. I can't tell you exactly why each case happened. In one case, the older Euro that did pass away eventually, she was eating carpet fiber, whereas the younger Euro was eating a very well-balanced diet, in my opinion. All of the food was soaked. There was not a diet of straight seed and dried lentils. There was fresh food, a high enough fiber content. It just happened. Temperatures also play a role. It's a really big thing I obviously didn't mention, but everything in reptiles depends on their environment and their ability to regulate that by moving to different micro environments within their tank. So the temperature thing is a big one. Cool temperatures are more likely to cause impaction. That was a long-winded answer.
That was an awesome answer. And I have like 10 follow-up questions that I'm going to forget by the time I get through the first one. Okay, so so basically what you're saying is a lot of the time it's more husbandry related than or a lot of the time, how do I phrase this? Yeah, a lot of the time it's more husbandry related that something like this could happen rather than just, he picked up some substrate and ate it.
I think, I want to say it's multifactorial because I can't always blame it on husbandry, especially when we get into the Uromastics conversation, because I know I'll be treading on some dangerous ground there.
Right. And like you were saying, some of those cases were really well taken care of animals and it still happens. So there could be some factor. Okay, that's interesting. Okay, so first of all, on the surgery, how hard is it? And I'm sure you probably get asked this all the time. How hard is it operating on something so small versus like a larger animal?
There's pros and cons to both. Small, I will say that I prefer, just total preference. This has nothing to do with really veterinary medicine, but I prefer surgeries where the chance of death is higher, because I feel like there's an urgency. I feel like what I'm doing, I'm more bold in how I'm approaching it. And I feel like for me, it's much more rewarding. We do them all the time, spays and neuters. For some reason, they just give me a slightly more stress. Perhaps I just perform better in a stressful environment. But when someone goes in and expects that, everything's going to be fine, it's just a regular rabbit spay, it's complicated. You're taking out several organs. You are tying off many vessels. Not every rabbit body has read the textbook and put things in the right place. And it's a healthy bunny going in. But when they're a little bit sicker and it's a kind of die or die trying situation, I quite enjoy that. Now, in terms of technical, how difficult it is technically, sorry, my cat is being one.
Okay.
Wait, go away.
He wants to be involved.
The sound of her licking is a lot for me to handle.
It does take the focus away. You're like, what's happening over there? Yeah.
Oh, anyway, so she, sorry, away from the cat. In terms of technical ability or how difficult it is to do a small surgery, small surgeries are hard. It makes sense. Working on tiny things is difficult. You have to have some specialized equipment. You have to oftentimes wear magnification. Sitting down is very helpful so that your arms are more steady if you can rest them on the table. I like reptile surgery because how reptile vasculature works is there's just less vessels, so they're just more obvious to me. Whereas you can be going through a mammal and they're just bleeding and I don't, why you, there's so much going on. Whereas reptiles, it's like there's this ventral abdominal vein. I can see where it is. I can see the tributaries. I can decide if I'm going to tie something off or not tie something off. I think a medium-sized animal is probably the easiest thing to do surgery on, because big is going to be hard and then tiny is going to be really hard as well.
Right. That makes sense. Okay, awesome. So another thing you said in the answer is dehydrated. Like that could be one of the bigger factors. And so one of the questions I had here is, do arid species need water, or are they getting it all from their food?
That's a good question. There are many species that don't seem to drink standing water, whether it's in the wild or in captivity. Bearded dragons are one of those species. And so it is then our job to provide them with water in their diet in a way that they can absorb, that they would absorb naturally. And then chameleons as well, they're going to mostly drink droplets that are moving. So that's why drippers are important. But providing water in the food, this is an opinion, Lord. I'm going to state an opinion. I think it's really hard to overdo the amount of water that you have within their diet. I think that that the body is very good at dispelling of water when it needs to. I'll just take bearded dragons for an example. They will actually have urine and not just urate if you give them enough water, and it comes out at the same rate. So it's just expelling from the kidneys. The reason that urate is formed is because they're so good at conserving water, so it can sit in the cloaca a little bit up, and they can reabsorb it that way. So it's concentrated excretions from the kidneys, and most reptile species can do this as well. So I would say that just to err on the side of, and of course, my opinion is because I see the worst of the worst. I see the impacted animals. I see so many Euros that have bladder stones. It's super common. So I would always err on the side of, let's make the food as abundant with water as we possibly can. So with beardies, I always say to provide them their veggies in a dish that's shallow water. You can mist them really heavily too. I would do the same thing for Euros. I would. Is it bad to feed dried lentils? I mean, no, a few here and there is probably not going to do anything. Their jaws are strong enough to crunch that. But would I? No, I think I would soak them. I think I would soak most things that they get. The amount of water that's in a live plant that an animal would come into contact with outside, in the outside world, is much higher than once we cut the roots and bring it into captivity and bring it from the grocery store. So do I put water in every animal's enclosure? I do. On the off chance that perhaps they do need it, you are not going to increase the humidity in your tank by any really observable amount by having a shallow dish of water available, especially when you have heat lamps on it, especially when you have the intensity of heat that you would have in a Euromastix enclosure or a bearded dragon enclosure, especially when you live in Alberta, where our humidity is like Sahara Desert.
Negative. Yeah.
It's nothing.
Yeah.
I would always provide that, but the argument is, well, they don't drink it, and that's totally true. I still would provide it. So because they don't drink it, you must provide it in another way.
Yeah, that's super interesting. What about feeding insectivores fruits and vegetables? Is there a negative effect? Could there be a negative effect on it?
I don't think I could think of a negative effect on that. Of course, you need to make sure that what they're consuming is balanced for what they would usually find in the wild. But if you had, so crickets and the bugs that they may eat are going to consume vegetables. So I don't think it would be toxic, but I could be wrong on that. And then in terms of the main thing that I would worry about is if you're feeding insectivores fruits and veggies, you have to be aware that beta carotene is in that instead of preformed vitamin A. That's what happens inside of other animals that eat veggies. So like herbivores, omnivores, they have the enzyme that converts beta carotene into the different forms of vitamin A that the body actually has to use. So if you were to do that, you would have to provide some supplementation, or like if this is just like a little bit of veggies on top of whatever they're eating, I seriously doubt that could be harmful. Yeah. I think everything in variety and in moderation is a good a good tactic to always use with any species.
Yeah, variety is key. Okay, so that's super interesting. And I did have a couple of questions about vitamin A, so maybe we'll just jump into that. So you're saying that they don't have the capacity to convert it because usually it's converted or already converted by the insects, I guess they're eating, or
So the thing with vitamin A, and this matters a lot for supplementation because there are certain brands that don't provide preformed vitamin A. So you have to be careful which one that you pick if you have an insectivore. Insectivores don't have the enzyme that converts beta carotene into the usable form of vitamin A. Vitamin A is very important for many things in the body. One of the most common ones that we would see or an owner would see is what's called squamous metaplasia. So when you have, there's kind of mucous membranes on the inside of your eyelids, and then other parts in the body as well. And those will produce mucus and things that are lubricating. Squamous metaplasia is when you replace those cells with essentially skin cells. And those are very dry. And imagine what it would be like to have the inside of your eyelids not be moist and lubricated, and now it's just skin. So then you'll get kind of squinting, you'll get pain, you'll get inflammation, so blepharitis. So a lot of animals will have their eyes kind of swollen shut almost. This is a really common presentation in chameleons, is there's just squinting that stays for a long, long, long time. And any regular vet would think, oh my goodness, there's something stuck in the eye or there's an infection. So they would treat over and over again with antibiotics and you would never get anywhere. But what's really happening is perhaps the people aren't supplementing vitamin A in its preformed form on the animals that they're feeding. Gut loading is possible. Gut loading is really, really complicated. There's a lot of studies recently out of Mark Mitchell's lab does a lot of gut loading research, but there's many others as well, that the things that we think we're gut loading with may not actually be consumed by the bugs that are there, especially if you provide anything else other than the gut loading diet. And we don't actually know what the concentrations of calcium and vitamin A are in after they've been gut loaded. So I think we should still err on the side of providing the right supplementation on the outside of the cricket. Hard thing is some animals don't want to eat that. So that's going to be difficult. And you don't know how much that you're putting on. Just dusting crickets, unfortunately, there's no way to measure, I've added this many milligrams of dust. And depending on how many crickets you have, we don't really know. And these supplements that we're giving, they're not like regulated by, I don't know what it's like in the States. But in Canada, we don't regulate those natural products. So we don't really, no one's retesting what's in those products. And when we do retest them in studies, we're finding that they're actually not the same as what the package insert says. So unfortunately, it's all, bless you.
Thank you.
Unfortunately, it's a little bit unknown. So we'll go back to the insectivores. So there are products that have beta carotene in them and not vitamin A. And if you're to give that to an insectivore, they'll never get vitamin A. So they'll develop hypovitaminosis A and have all those issues. I've sort of lost my train of thought because this stuff is so interesting.
Sorry.
No, that's okay. I'm just trying to, we'll find where we are. Yeah, so that's the main thing with vitamin A is finding out on the label it should say vitamin A.
Say vitamin A.
Yes, for insectivores. Now, carnivores also oftentimes may not have that enzyme, but they're usually consuming whole prey. So they're consuming liver. That's where vitamin A is stored because it's a fat-soluble vitamin. So you don't usually have to supplement them.
That makes sense. So you said it actually has to, so if it says beta carotene, it's not actually vitamin A. It actually has to say vitamin A for insectivores.
Right. You could use a supplement that says beta carotene for an omnivore or for an herbivore, but you wouldn't want to use that for an insectivore for your only supplement because they won't be able to convert that into vitamin A. So it should say vitamin A on it. I know that Zoomed Reptivite has a vitamin A on it. Pretty sure there's a Rapashi one that has a leopard gecko on the front that has it. I'm unsure about Exoterra. I'd have to look into it, but those are just the ones off the top of my head.
Should have one around here somewhere. I was like, let me check right now, but okay, never mind. It's in the other room. I will be checking after this episode. That's super interesting. Okay, so this actually with dart frogs. Yeah, so with dart frogs, we're also it's super important for breeding. Can't be breeding dart frogs without vitamin A. Is it the same thing for amphibians that they need it? And would you use the same type of vitamin A as you do with reptiles?
That's a really good question. I hate to give you the answer of we don't fully know.
We don't know. Yeah.
I think that it would be not a bad idea to supply it. The hard thing about vitamin A is you can overdo it. It's possible to get hypervitaminosis A. So what can happen with that is excessive skin sloughings. What's that human product to treat acne?
Accutane? Accutane, something like that. Yeah.
So Accutane is essentially an overdose of vitamin A. So it like helps slough off all the skin, and then it also stops producing some of those cells that produce oils and mucus. So that's how that works. So we can do that. Oftentimes, the most common way that an animal or a reptile or amphibian will get hypervitaminosis A is iatrogenic, which means that a vet has done it, or a person who's given it an injection of vitamin A. So if at all possible, I try to not give vitamin A by injection. I try to change the diet in a way that we can get it into them. The hard thing about going back to hypovitaminosis A, the hard thing about that squamous metaplasia, when those cells change into skin cells, I don't think the process is very reversible. Unfortunately, they may get stuck where they are, and you may be lubricating the eyes for the rest of the life. Wow. And I say that with a little bit of caution. I don't know if the studies have been done to see how well that would go backwards, but I just worry that it might not be able to go backwards as well. And then frogs. So short tongue syndrome is the colloquial way of often referring to a process that happens because of hypovitaminosis A. And that's because of squamous metaplasia. Their tongue is no longer sticky. So it looks like they're not getting to their prey, but really they may be, but it's just not sticking because they have skin on their tongue now. So I would think that it would make sense to me. So what I understand about looking into this is that we don't know which amphibian species do or don't have the ability to convert into vitamin A. So I would err on the side of let's offer it sometimes, with the idea in mind that you can overdo fat soluble vitamins. A, D, E, and K are all fat soluble, and they get stored in the liver. If you have a more obese animal, maybe more likely that you're going to keep those vitamins around longer. So every once in a while, which is a super non-committal answer, and I do apologize for that, but we just don't know.
Yeah, no, that's super interesting. So with like I said, with dart frogs, it's always recommended dose them twice a month if you're breeding, give them this, give them that. And with the reptiles, it seems most people tell you to just do calcium with D3. Do you agree with this, or do you think that we should also be dosing them with vitamin A and supervite and all the other vitamins?
If you have an omnivore, I think that the use of a multivitamin is less so than if you have an insectivore. My recommendation for now, and this is a generalized recommendation based on what we do know and based on what I've seen work well. If we have an omnivore, I say every 3 weeks or once a month, maybe, to do a multivitamin. What you have to look at is the content of the feed that you're feeding your animal and what the needs of that animal are. So the main concern with, there's lots of concerns with nutrition, yeah. But a big one we'll stay on calcium perhaps. Most of the grocery store vegetables that we feed don't have the correct calcium to phosphorus ratio for many reptiles. So we try to get like a 1.5 to 2 to 1, so more calcium than phosphorus. And that's not always easily achievable. The way that we get around that is by offering variety, and then offering calcium supplementation. Is it possible to overdo calcium supplementation? I think so. I don't think we have extremely great research on this yet, but I think that it would be perfect to just provide the greatest natural diet and then not have to add any extra supplementation. And if you can get that, that's great. Like with tortoises, if you can get them to eat hay or some derivative of that, I think you're doing the best at like land desert tortoises.
Yes, yeah.
Then I think you're doing a really good thing. But where we can't, or where say we're limited in what we can provide, I would usually err on the side of straight calcium for most things to just tip that balance of calcium to phosphorus. Where you're going to get, why D3 is important is because D3 is what makes your guts absorb calcium from the diet. If you don't have D3, you can't do that. D3 can be made in the body, and it can be made by exposure to UVB light. There's some pretty good research that's quite new, looking at UVB exposure in leopard geckos. There is always going to be a balance, I'm sure, with on almost anything that anyone talks about. What the studies showed was that if you expose those animals to UVB light for, I think it was 2 hours. I could be wrong on this. I think it was a Mark Mitchell study, or out of his lab anyways, for 2 to 3 hours per day. And then you measure, because you can, with a lab test, measure how much vitamin D3 is within the body in the bloodstream.
Yeah.
That they respond to UVB light like other animals would, and how we would expect them to respond. And in that, then we would assume they can absorb calcium. But what they found in a preliminary study was that if you expose them to UVB light all the time and they don't have a hide, they go through a continuous shed cycle, almost like a sunburn. So you can definitely overdo that. So with leopard geckos, if you don't have a UVB light every once in a while for like an hour or two a day or here and there throughout the week, I think you should still do a multivitamin that includes D3. But each time you feed a bug, unless it's a dubia roach, unless it's a black soldier fly larva, the calcium to phosphorus ratio is going to be completely inverse. Crickets, waxworms, mealworms, superworms, everything has higher phosphorus than calcium. And over time, that's going to make your animal pull calcium from the bones to do regular bodily processes like muscles, whether they're smooth muscles in your gut or whether they're skeletal muscles in the rest of the body. Mm-hmm. So that's why I would always, so my main recommendation to summarize all of that, and like recommendations can certainly change over time. I don't want to be wrong for a second longer than I have to be, but for right now, what I often say is, if you have an insectivore and you're feeding them, say 3 times a week, I would dust the bugs with straight calcium. If you can gut load the bugs, I would do that. One gut loading product is I got this wrong on Dylan's podcast. I said the wrong brand.
Passion Bug Burger?
No, is it Missouri?
Oh, Missouri? Oh.
I can't remember if I think it's Missouri. I think it's Missouri high calcium gut load. I'm actually quite like 99% certain.
Okay.
Because this was also from another study from that same lab, is that if you don't have over 8% calcium dry matter within what you're feeding your crickets, that will not turn into a 2-to-1 calcium ratio when the animal eats it. So most of the over-the-counter gut loading products don't have that amount of calcium, and they will not gut load that bug properly. But you can't provide anything else for the crickets to eat, because we feel that the bugs don't find high calcium feed to be very palatable, so they don't want to eat it. So if you give them,
go for whatever else.
What's that?
They always go for whatever else you give them.
Exactly. Everything else tastes better. So just water. So water in the form of wet paper towels, or water in the form of soaked cotton balls, because the bugs can get dehydrated and they often die from dehydration as well. And then just the feed. I just use the feed for my worms as their substrate, and then provide water in another way. So if you do that and you're sure that that's a good gut loading, then that's okay to perhaps not dust your crickets with calcium or your bugs. I would still do, for an insectivore, a multivitamin once every 2 weeks. So I would dust them once every 2 weeks with a multivitamin that has preformed vitamin A. Another thing about dusting is some animals prefer not to eat it. So that would be a way where you'd want to look into making sure you know how to gut load properly. Another thing is that they breathe through, I think it's called spirochetes, but I don't quite remember, that where they breathe through something on their skin, the crickets will. So they don't like having powder on them, so they'll immediately groom it off of them. So if you dust your bugs and then you put them into the cage and you walk away, they may groom off all of that dust anyways, and your animal's not getting what it needs. So this is the most important thing, I think, for people who want to get into reptile medicine as a vet, is the history is so important. You can't just say, do you dust? What do you dust with? How long do they eat after? And all of that is very important.
Yeah. The more you get into it, the more complicated it gets, and it's just super interesting.
I think, and I like that people are looking into which products actually work and say that they do. Or my most exciting thing, I think, in all of life, but in veterinary medicine, we just talk about that, is finding out that something we thought was right for a long time is actually definitely wrong.
Wrong, yeah. Okay, so that's perfect jump into this question. Are there any new advancements or breakthroughs in veterinary medicine or any veterinary medicine, not just necessarily in exotics, that have transferred over to reptiles or exotics?
Yeah, I think that with every advancement in the normal species that most vets see, the dogs and cats, and any exotic. Any advancement there, we're very quick to say, well, let's try this here. Let's try this in reptiles. Let's see how or why this works or why it doesn't work. The most recent advancements, I would say, is just in our knowledge of what doesn't work in reptiles. So different pain medication that works very well in mammals does not work in many reptiles. So there's different types of opioids that you can use depending on which receptor that they attach to. And in reptiles, it seems that only certain ones work. Another one is anti-inflammatory medication. So there's a very common medication called meloxicam. It's very similar to Advil in people. And for different species, you have to use very, very different doses. So straying away from reptiles for a second, in rabbits, to get that plasma concentration, so to get the concentration of the workable drug in the body that seems to cause decreased pain, you have to give about 5 times the dose that you would give a dog. So you have to give 1 milligram per kilo to get
a rabbit.
In rabbits, yeah.
Wow.
And in birds, it's even higher. Many birds, it's 1.6 milligrams per kilo, twice a day instead of once a day. And that would kill a cat. It would absolutely shoot its kidneys into nothing. Wow. In reptiles, we don't have very good evidence that it works, but it's hard to test, right? They don't respond to pain the same way and as consistently as many mammals do. They don't respond to, I get all excited about research.
Yeah, go ahead. Yeah, this is awesome.
To test what we know, we have to, you can't just assume that you're going to know how and why. If you look into why the studies mattered or why the studies were good or bad. To test pain, oftentimes in mammals, we have a model of nociception, which means reception of pain, that is a heat-based. So you put like a laser, say their foot is here, you put a laser underneath it, shine that up into there, and that's supposed to cause pain, so they move their hand away. That doesn't work the same in reptiles. They don't have the same pain receptors that other animals do. So it may look like the drug doesn't work because they don't move their hand away, but is that how a reptile feels pain anyways? Like we've seen heat burns many times, snakes wrapping around, heat lamps that you think, well, why didn't you move? It's just they don't
feel the same way. Yeah.
In their normal natural life. So how they evolve is very different. Naturally I went on another tangent there. Pain. So advances is what we were talking about. I think advances sometimes don't look like advances. They look like breaking down what we already thought we knew and laying it for, okay, how do we now build that up and what is actually going to work in reptiles?
Can you share, and maybe I'm hinting towards the one that we were talking about before the episode started, but can you share any interesting case studies or success stories or something that you're currently working on?
Which one did we talk about before we started?
The one with Dr. Alec.
Oh, yes. Well, yeah, that was actually very interesting. So I was seeing a Shinosaurus that was a female. And of course, since this is a CITES animal, very endangered, very special, making sure that we did everything as best we could to not only save this animal, but save her breeding potential was important. She had what looked like just a wound on her pinky finger, or like a fracture. There was a bone exposed. So I amputated the digit, and I sent that to the lab just because honestly, this is why testing is so important, because it can look like the same thing over and over again. It can look like maybe she caught it on something, broke it. Now there's a bacterial infection and she has her bone exposed. But other things can cause that. So I sent that to the lab and it actually came back as sarcoma. It came back as a cancerous process, which has never been reported in a Shinosaurus before. And it's actually quite rare in reptile medicine to have sarcoma. Oh. And it could be just a process of not many people bring their reptiles to the vets. Not many vets are comfortable treating reptiles, so we just don't have the information. It's not getting sent off like it is in dogs and cats, so it could be a product of that. But yeah, that was very interesting. But she also had ovarian follicles, so it was interesting to use ultrasound to try and see how big her follicles were, to see how she was cycling, because it would have been nice if she had bred. So in talking to Dr. Alec, we were trying to compare, just because he was monitoring some Shinosaurus and how her follicles were doing. So we wanted to just see, how do we collaborate on this? Because there's very few Shinosaurus individuals.
In Canada, yeah.
Yeah, very, very few. So that was a very interesting connection and it's nice to share information across vet lines too. And him asking about anesthetic protocols that I use and sharing that knowledge is great.
That's very, very cool. Is there any other really cool rare species? Like, I'm sure you get a lot of bearded dragons and ball pythons and everything, but is any really cool reptile species that you've dealt with before?
Any really cool, I mean, rare ones. I
Have
feel
you
like
ever seen mountain horn dragons?
no.
No. Okay.
Oh, have I? Maybe in my first few years, I may have. Um, but yeah, I'd say Shinosaurus was the
The
most
coolest.
definitely rare species that I
Mm.
have seen that comes to mind. Um, but yeah, I enjoy seeing any reptile that comes in. I'm pretty happy to see.
That's right. Here, so is there? Oh, reptile room's on.
No,
Is there? Does it make a difference? And this may be like a really stupid question, but does it make a difference when an animal is semi-aquatic versus like a completely terrestrial animal?
it does,
It does.
especially
Okay, cool.
well in terms of anesthesia, it makes a difference. And there's probably differences that we don't understand about medication yet that still have to be studied. We still barely, I would say, reptile um, drugs are in their infancy in terms of which doses that we use. There's a very common, I will totally get back to your question, I'm sure, but on another tangent, there's a very common medication that we use that's an antibiotic called ceftazidime. And that antibiotic has been studied in, I want to say, I don't know if there's ever been what's called a PKPD study done in it. So pharmacokinetic pharmacodynamic, which means when you take the drug, where does it end up in the body and in which concentrations, and is that effective? So we use a dose that was reported, I think it was in iguanas a really long time ago, and we don't really know where that goes in terms of bearded dragons or Shinosaurus or any other species. There are differences between breeds of dogs and breeds of cats, like fatal differences in how you
Yeah.
apply medication. And we're talking species differences. So there's just so much unknown.
Can't generalize reptiles.
It's really hard to generalize reptiles.
Yeah.
And sorry, what was your question on what I was just tangenting on?
Good question. I got into the tangent too.
Oh, aquatic species. So
Yes, yes.
there's a difference in anesthesia because of the nature of how their bodies work, and especially ones that can hold their breath for a very long time. I remember talking to an anesthesiologist that I had done research with in vet school, and he said the most annoying thing sometimes was anesthetizing diving animals because they have a diving response to what goes on physiologically within their body.
Right.
And it's just difficult to, when they don't breathe, how do you give them the drug?
Yeah.
The inhalant drug anyways.
That's very interesting. It's very, very cool. Okay, I think I'm gonna wrap it up. But as a final question, since we're back on the aquatic animals, what about newts and salamanders? Is that something you ever see? And is there a difference sort of in dealing with them?
Yes. So I do actually see a fair amount of salamanders anyways here.
Really?
Yeah. A lot of people will find them outside. And
Oh, okay. So like native species of salamanders.
yeah, yes. And they're different, they're similar, I would say, in like dealing with frogs. Their skin is very absorptive. You can provide anesthesia that way, but you can still give injectable antibiotics. I mean, I say you can, but I don't know of any studies that show where that goes in the body and how effective it is, but we certainly try. And you have to be careful, of course, in how you handle them, what kind of gloves that you're using, and what kind of fluids that you're using on your hands to lubricate your hands.
For sure. Awesome. Kelsey, Dr. Chapman, thank you very much for doing this. Thank you very much for coming on. That was a super interesting episode. I know I'm going to enjoy editing it because I'm going to have to rehear everything like 100 times and I'm going to be like, wait, what did she say again? But yeah, thank you very much. Can you let everyone know where they can find you and where they can keep up with the work you're doing?
Sure. I wouldn't say I have a public forum for all the work that I do. I have my Instagram is at Kelsey R. Chapman. And then I'm at Calgary Avian and Exotic Pet Clinic is where I work. So if anyone needed to book an appointment, they can go on our website or call there. And then our work Instagram is at Calgary Pet Vet. But yeah, and that was a pleasure being here. Thanks for having me.
Yeah, for sure. I don't think I'm following Calgary Pet Vet actually. I know I'm following you, but I don't think I'm following Calgary Pet Vet. So I'm going to do that right now as well. And
No.
everyone find all those links in the description. Thank you for listening, and we'll see you on the next one.